Have you ever looked down at your own hands or the hands of somebody else and you thought, wow? Today, I want to talk about why that happens and what you can actually do about it. Hi, everyone. I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel as we age. The veins become more visible, the tendons become more visible, things become more thin and more frail looking. There's an increase in sunspots, there's a discoloration to the hand, there's a thinning of the skin. All of these changes can be very, very frustrating because you might be doing everything right for your face, and then you look down at your hands and they're telling a completely different story. They're kind of a dead giveaway for how old we actually are. As a facial plastic surgeon, I think about things in two layers. There's the surface aging, what's happening to the skin itself, and then there's the structural aging, what's happening beneath the surface of the skin. Most people think about things on the surface, but the structural piece is what actually drives the most visible change, especially when it comes to the face and the hands. And when I'm out doing my facial rejuvenation procedures, it is so uncanny that sometimes I look down at my patients after surgery and it occurs to me that the hands are giving away the age. And we actually have treatments that we can do for that. And sometimes, frankly, I literally forget to share this with patients before surgery. And honestly, it's one of my biggest blind spots as a surgeon because I actually have some effective remedies for that sadly, unless the person brings up their concerns with their hands, I rarely remember to bring it up at consultation. But it's good for you all to know this, and this is something you can proactively begin to address whether or not you have facial surgery or not, keeping those hands looking youthful. The changes are happening in both dimensions at the same time, and that is really where you start to see this sort of bony, veiny, older look occur, and this is the dead giveaway. So let me explain what's actually happening. When you're younger, there's a layer of fat that lives in this section of the hands that covers and softens the tendons and the ligaments of the hand. It acts as a padding. It gives the hand that full, soft appearance, right? And the most extreme example is that when you think of like a toddler's hand, it's like literally, it's like a convex roundness to it. And as we age, we lose some of that. And then eventually we get to a place where we shed off most of that fat. And as a result, the hands start to look frail and bony. So as this fat begins to diminish and disappear over time, and this is an important point, the face and the hands both lose volume as we age. They become more gaunt and hollow. And as you lose the structures underneath, that's when these tendons, the veins, and ligaments all start to become much more noticeable. So here's the thing you want to understand, because this is something that people talk about a lot. They say, oh, my hands look so veiny. The veins didn't suddenly get bigger and the tendons didn't suddenly change. What changed is the padding around them that used to soften and camouflage them are now gone. And as a result, the hands start to look skeletal. And no amount of surface level treatments alone will fully address that issue. So we're going to talk about what the different type of treatments are, but many of you have probably experimented or considered lasers or chemical peels, etc., to treat the skin of the hands, but maybe you didn't realize that there's something more going on. So let's talk about the surface side a little bit before we get into the options. So now let's talk about the skin. What is happening there? So the skin on the back of the hand is already very thin and it's exposed to sun constantly. Whether you're driving or walking or running around doing errands, most people don't think to protect their hands, and maybe it's just not practical. But the fact of the matter is UV exposure in any part of the body accelerates skin aging. What does that mean? Collagen breaks down, elastin breaks down. The skin of the hands become thinned as the collagen and the elastin begin to diminish, but also you pick up pigmentation over time as that sun damage starts to accumulate. Interestingly, I had a patient literally just, I think it was last week, she came in for a vertical restore and she wanted to do fat transfer her hands, but she showed me something very interesting. So her habit of putting sunscreen on is, she puts it on her face, but then she does this to, take up some of the extra, only on her left hand. What was remarkable was that when you look she showed it to me. When you look at her left and her right hand, it was night and day the level of aging between the two in terms of the skin quality. The hand that received the sunscreen looked so much brighter and the skin looked so much more supple, and the other one definitely looked a lot more aged. So that right there was just, a small subconscious behavior that actually over years made a big difference and a very noticeable difference in the quality of the skin of her hands. This is not a small realization. That's proof of how much UV exposure shapes the outcome. And there's been tons of examples of, people who drive showing one side of their face, such a difference in the quality of the skin. So I think it's not debatable that sun plays a huge role in skin aging. So I think that's why it's always my number one advice is address sun protection, and that gets you ahead of a lot of the changes that are coming downstream. Let's talk about what you can start to do. So again, the first and foremost important thing is get in front of the sun protection. So when you apply sunscreen, and hopefully many of you who are even interested in any of this are doing that because it's a non-starter when it comes to skin aging and all the other things that are involved in it. I've spent a lot of time talking about sun as a primary step in managing skin aging. But so when you apply your sunscreen, extend it to the back of the hands. Just add a little bit, to the top parts of the hand. That's it. That's a new habit that you can start to form, and you can really, really slow down the skin aging. So some of my patients actually who do spend a lot of time either driving or gardening, etc., will in fact wear UV protective driving gloves. I know it sounds a little bit extreme, but who cares? You're in a car, you're driving. If you understand the cumulative sun exposure and the exposure that happens in the car, it makes sense. It makes complete sense. It's worth doing. You've seen pictures that I've shared with you. My wife wears the facial mask when she's out doing all of her daily walks and things like that. Well, it's the same thing. You're trying to get a little extra protection against UV, and why not protect the hands at the same time? So the other habit I strongly recommend is also simple. When you finish putting your skincare routine on, whatever is left on your fingertips, don't just, wash your hands and wipe it away. Wipe it on the back of the hands. This is something I do every night when I put on my trifecta. I consciously started doing that because I heard from my patients and many friends, etc., that this is what they do. They put it on their face, and then what's on their fingertips, they put it on their hands. So I do that with Quench, and I do that with Illuminate. But if you're using actives as part of your routine like retinol and vitamin C, then every step along the way, just take a little bit of that extra and put it on the top of your hand. That cumulative effect of these things will definitely make a difference in the long run over time. So the other thing is sometimes retinols and vitamin C's can be a little harsh depending on the formulation. But for those of you who use the CareMD trifecta, absolutely feel comfortable doing this because it is formulated for sensitive skin and also for thin skin areas like the neck and the eyes. So you can easily put it on the hands with no issue. So let's now talk about if the damage is already there, what treatment options do you have? So if the hands have already begun to age, there's still a lot you can do. For the skin surface, treatments like IPL, which is intense pulse light, or BBL, which takes the browns and the reds away, you can use that and you get a facial treatment. You go in there for an IPL, tell them to do the back of the hands for you. If you go get a laser treatment, they can treat the hands as well. Just go lighter with the hands, same thing with chemical peels. But this can address pigmentation and also stimulate collagen. I've actually never considered microneedling, but I don't see a real problem with using microneedling in that area too. But you got to be very superficial and careful because the hands can definitely bruise from this area. The skin is a lot thinner, and sometimes if there's not that cushion there, it can cause some bruising. But definitely for lasers and chemical peels, lighter settings, you can definitely use it to wipe away some of those discolorations and also stimulate some collagen. Now, let's talk about the structural component, the thing that gives the hands that skeletal look to it, right? As we age. And like I said, we see this, sometimes in my own patients, but we see this in people who go out and they've gotten a nice, beautiful full facial rejuvenation, and then they hold up a glass of wine and suddenly there's like a dead giveaway that this is, we're talking about a different age group here. So it's an ideal thing to start doing. And I'm going to give you some simple approaches to it. So as far as structural change, it's volume loss is causing it, it's fat loss. So restoring some of that lost padding. Now, keep in mind, you can't treat the fingers, but you can treat this part very, very safely and often dramatically improve and soften the appearance of the tendons and veins. And this is something I've been, doing and advocating for our patients for 20 years. So in my practice, I do this in two ways. There's scenarios where we use fillers and there's scenarios where we use fat transfer. If you're not undergoing a facial fat transfer, well, we're not going to go do fat transfer to the hands as a primary thing. It would be kind of a pointless and wasteful thing to jeopardize a source of fat just to put it into the hands, because fat is a scarce thing, and especially for a lot of people who are on the thinner side, and you don't want to have to go into the same donor site twice. So I do fat transfer for people who I'm doing a fat transfer for on their face. I'll do some in their hands. There's two options. One is hyaluronic acid or calcium hydroxyapatite. So hyaluronic acid products are things like Restylane and Juvederm and things like that. I'm not a big fan of the HAs, the hyaluronic acid, because there's a tendency sometimes to have a little bit of a Tyndall effect, kind of a bluish green discoloration, especially in thin areas. Historically, we've always used calcium hydroxyapatite, which is Radiesse. And actually that works quite nice. It's you dilute it with a little bit of plain lidocaine, and inject it into this area, usually one syringe split between the two hands. And if you need a little bit more, 4 to 6 weeks later, you can go back and put a little bit. But that softens nicely. In fact, my wife did that. We did it for her once or twice over the years. And when I did her, vertical restore and all that, I didn't put any fat in it because I didn't really need it. The fillers in that area do hold up pretty well. So again, I like Radiesse in that area. I know some surgeons and doctors like to use hyaluronic acid products. So that's a personal conversation you're going to have with them. I don't have any experience with HAs in the hands. But again, if you're undergoing a fat transfer or facial rejuvenation procedure, this is a good time to consider doing the fat transfer to the hands as well. Something, again, we do, I would say, not frequently enough given how ubiquitous the need for it is, but that's just a blind spot. I think every single patient that I operate on would benefit from this, and this hopefully will be a reminder to talk about it a little bit more. But why I like fat in that area is because it's replacing like with like. It's your own tissue. We haven't had any problems with the fillers in that area, but again, it's just a nice way of getting something permanent into that region, so you don't have to mess with doing it again down the road. It's not a miracle. It's not it doesn't make your hands look 20 again, because I said there's changes that are happening to the skin, usually in the same time that are these structural changes, but you can't reverse it all at one time. But it gives a little bit of softening back to the hands and definitely makes it better, and certainly keeps it from aging more as time goes on as well, in terms of thinning and all the other things that go along with it. So that's the story there with fat transfer, a great adjunct procedure to any other facial fat transfer you're having done. But the bigger point is just think about it globally. You want everything to look rejuvenated, and ideally the hands kind of fit into that as well. Most people think about aging exclusively in the terms of the face, and clearly I do too. But the hands often tell the story just as clearly, and sometimes they are the dead giveaway of what's going on, in terms of your aging. And it kind of looks a little off when the two are widely different. The good news is, though, the same approach that works for the face works on the hands. Protect the skin, maintain it consistently, be good with sun protection, use actives. When it comes to structural support and volume loss, well, you can put some back in the way of fillers or in the way of a fat transfer. The earlier you start the process, the more you're preserving, but it's never too late to make a meaningful difference. And I think that's the real moral of the story here. If you found this helpful, make sure you check out the CareMD Journal and subscribe to that. That's something that we write. It's free. It comes to your inbox and gives you all sorts of great topic discussions, all things facial rejuvenation and wellness and everything else. If you enjoyed this video, make sure you like it. And if you haven't already, subscribe to the channel, share with somebody who you think might need it. And until next time, thank you so much for watching. I hope you learned something. Dr. Amir Karim.